Have you ever wished for a more sculpted and toned body and you've tried diet and exercise and just not seeing the results you're looking for? Well, body contouring might be the answer for you. Body contouring is a cosmetic procedure where we look to redefine and resculpt your body using removing excess fat and skin. It's really popular among people who have either lost a significant amount of weight or have tried diet and exercise and still have resistant areas that they're wanting to have look better. Did you know there are several types of body contouring procedures available? Well, let's explore a few of those. Both surgical and non-surgical options are available. In regards to surgical options, the most common or most well-known is liposuction. It's been around since 1974, so we have a lot of experience with it. There are a lot of different ways you can use liposuction, a lot of different techniques. Liposuction is essentially removing fat deposits from the area that we're concerned about. The most common area or popular area is the abdomen. There's also tummy tuck can be used in the abdominal area to really tighten that area. So we remove excess skin and fat in that area to really tighten it up. But there's also other areas you can use surgically to really get a sculpted look. So that will include the arms. You can do what's called an arm lift, neck lift, thigh lift, and even a body lift. And so all of these things are essentially removing excess fat and skin in that area to give us a more contoured look. Now, there are several non-surgical options as well. First of those would be laser. There's a lot of different laser treatments out there, including TrueSculpt ID. There's Sculpture, a number of other laser treatments that can target fat. Essentially what this does is heat up the area to a certain temperature, which will cause those fat cells to die. So this happens over several months. Also, you can use radio frequency with the same idea of heating the fat in that area to a certain temperature and have them die over the next 2 to 3 months. Ultrasound is another option. The same idea is that it's going to heat up the tissue in that specific area to a certain temperature and have the fat cells die over a similar time period. Now, we talked a lot about heat, but you can also use cold. So CoolSculpting uses something called cryolipolysis, which essentially is freezing the fat cells. This happens over the same amount of time. The fat cells will die over the next 2 to 3 months. And so we lose that excess fat in that area. There's also something called mesotherapy. What that is, we inject a chemical solution into the fat area, essentially will dissolve it, and we will see results over the next 1 to 2 months with that. Most common or well-known of that is something called cryo. So benefits of body contouring: imagine feeling more confident in your skin and loving the way you look. So a couple of the benefits of body contouring is enhanced body image, having a more sculpted and toned physique. But also probably the biggest benefit is increasing confidence and self-esteem that you have in your appearance. Like any medical procedure, body contouring has its own risk. So from a surgical perspective, there's several risks, including a risk of infection. Anytime we cut the skin or make an incision, there is a possibility of infection, even though it is very low. Also, there's a risk of scarring because, again, we are cutting the skin. So you could have a scar form in that area. And there's things that you can do about it, but it's certainly a possibility. From a surgical perspective, you also have the risk of anesthesia, whether you have a reaction to it or side effects, including nausea, dizziness, sometimes sedation. There also is a risk of blood clots. Now, this is very uncommon, but it's certainly a possibility. And then nerve damage is something that can happen, whether it's temporary or permanent, where you can have numbness or tingling in that area for some time after the procedure. From a non-surgical perspective, in regards to risk, so no risks really in regards to infection other than mesotherapy or cryo, because though that procedure is introduced in a needle, so there is a risk of infection there. However, with laser or radio frequency, ultrasound, or cryolipolysis, those treatments are not going to have the infection risk. Commonly, people do have soreness after a procedure. Usually it's not enough that people require pain medication. There's a possibility of bruising, but this is uncommon as well. Wondering what the recovery process is like? Well, for a surgical recovery, you're going to have some type of compression garment for at least the first couple of weeks to really help that area heal. There may be some wound care involved. though it's minimal, is part of the recovery process. You're really going to have to avoid any strenuous activities as well for the first couple of weeks. And likely you'll be prescribed some pain medication to help for those first few days post-operatively. In regards to non-surgical recovery, it's really minimal. Most of the time, in fact, you can go back to work that day. We do ask often that you avoid any strenuous activity for the first couple of days, and then you can return to your normal level activity. Often people do not require prescription pain medications for any of the non-invasive treatments. For both type of procedures, you do want to make sure you're well hydrated and you're having regular follow-up visits with your provider. So if you're ready to take the next steps into a more contoured body, you're going to want to first look at what one makes more sense for you, surgical versus non-surgical, and really do your homework. And then I would suggest talk to providers about what they suggest based on what your goals are. Comment below with other questions you might have. Otherwise, check out one of these VODs. Subscribe if you'd like to hear more content like this. We'll see you next time.